River Falls on League is in the traditional territories of the Lakota people and the part of the Kwakwaka'wakw cultural family. And that's the most beautiful hospital in BC.
And Jaka, thank you. I wanted to respectfully acknowledge that the work that I've been doing takes place on the unceded ancestral territories of the Ho'okaminam-speaking Coast Salish people, specifically the Coats and Northern Cowichan.
None of us have any conflicts of interest. So this is the story of our sending site in Campbell River. And I'm going to start by telling the story of a woman. She's 27 years old. She's in her 4th ongoing pregnancy, and she's meeting me at the maternity clinic in Campbell River, having been referred by her providers in the remote community. She lives in a community of 1,200 people. And so she had her first baby at term at 38 weeks. Her second was born early at 34 and a half weeks. Now she went into labor in her community. She was being transferred, medevaced. Things were getting exciting. They poked into Campbell River, and she ended up delivering in Campbell River before she got to the higher level of care. And her accoucheur stands beside me. Yeah, coincidentally. So that baby was transferred emergently to a higher level of care and spent 2 weeks in the NICU in Nanaimo. Her 3rd pregnancy, she went into labor again in her remote community. Things progressed really rapidly, and her baby was born at 33 weeks at the community health center. And so medevaced again, baby was taken by the neonatal transfer team to Victoria, where spent 4 weeks. Mom followed after and was eventually reunited about 4 weeks in the higher level of care, far, far away from her community. So the referral letter expresses significant discomfort, and they're advocating that she relocate much earlier than ever before around preterm because of her previous preterm deliveries. And this is just one story. We were seeing many stories very similar in our work traveling up to Port Hardy, which we were doing on a monthly basis together. And we recognized that there was a gap. There are evidence-based, effective preventions for preterm birth. And preterm birth is the biggest driver of perinatal morbidity and mortality. So there was this gap in between what we can offer and what is being offered. And fortunately, this is in 2018, some facility engagement funds were available. So we asked for the maximum funding that we could from our Medical Staff Association, which was $10,000. And we embarked on the creation of a preterm birth prevention pathway.